Hello, and welcome to another segment of Let's Get It Straight. I'm Katherine West, Infection Control Consultant, and today we're going to do a review of the disease that is spreading rapidly across this country, and that is norovirus. So let's get started. Our objectives: a brief introduction. We're going to talk about how this is transmitted, the special needs to achieve disinfection, and personal protection for EMS personnel. Let's start by reviewing some of the statistics that have been published by the CDC. Norovirus is the leading cause of diarrhea and vomiting from acute gastroenteritis. There have been over 2,500 outbreaks reported each year, and 58 of them have been related to food-borne illnesses. This virus affects all age groups and all economic groups. It's responsible for 900 deaths in persons ages 65 and older, 109,000 hospitalizations, 465,000 ED visits involving young children, and 19 to 21 million illnesses. Currently, it is reported that there are at least 41 genotypes for this virus and subtypes to each of those, and the number may be even higher. Different genotypes can infect humans over their lifetime, and there's no long-lasting immunity. Norovirus is called stomach flu, but it is not related to seasonal influenza and not related to food poisoning, although many people believe all of this is a synonymous term. Outbreaks can occur year-round, but they're mostly between November and April. Well, it seems to be different this go-round because we are still seeing outbreaks, and currently this is June. So our recent outbreaks are now affecting the Northeast. In December, a norovirus outbreak was linked to a North Carolina sushi restaurant and sickened over 241 people. With regard to outbreaks, the FDA is currently advising restaurants, retailers, and consumers to avoid selling or eating some oysters that come from Baja California or Sonora, Mexico. Outbreaks also involve long-term care. They make up almost 60% of outbreaks reported. And of course, probably the most we hear about are related to acquiring this illness on a cruise ship. So what about the source of this virus? Eating or drinking fluids that are contaminated, contact with contaminated surfaces, and sharing utensils or food and drinks with a person who currently is infected with norovirus. Transmission, we hear most frequently that it's fecal oral, and that this virus only requires a very low dose to infect an individual, as low as 8 copies of the virus. Remember, when we talk about risk for disease transmission, dose of the organism is a key element. But there's another route, and probably one to believe to be more communicable, and that is the vomit oral route, because this puts droplets into the air and adds to surface contamination. Signs and symptoms for norovirus: acute onset of vomiting, watery, non-bloody diarrhea associated with abdominal cramping, nausea, and that's what leads to, of course, vomiting. This is an illness that has a very short incubation period. From the time of ingestion to the onset of signs and symptoms ranges between 12 and 48 hours. Well, what about testing to confirm diagnosis? Polymerase chain reaction testing is available. There are test kits on the marketplace, but currently there's not a whole lot of faith in them. So if you contract norovirus, how long does it last? And most of the literature says it lasts about 2 days. Well, this is a real popular ad right now. Norovirus, you don't want it. And I think we can all relate to that for sure. So this illness is difficult to prevent. It is also difficult to control. This virus can linger on objects and surfaces for days or even weeks. A person can shed this virus for up to 2 weeks, even after the symptoms have subsided. So what is important for prevention of acquiring this virus? Well, as always, with infection control, it begins with good hand washing. And hand washing involving norovirus requires the use of soap and warm water. Our alcohol-based foams and gels do not kill norovirus. At home and in our kitchens at the stations, we need to make sure that we wash fruits and vegetables before use. You know, this is a really resistant virus. It can take temperatures up to as high as 145 degrees Fahrenheit and survive. Has been noted to survive on countertops for over 42 days. All of our equipment, surfaces in our kitchens should be cleaned and disinfected using a chlorine-based solution. Remember, this is a very hardy virus, and we need a chlorine-based solution to kill it. Our laundry we can wash as usual. Nothing special. So as part of prevention, what personal protective equipment should be worn when caring for a patient suspect for or diagnosed with norovirus? We're going to, as always, use standard precautions. And we're going to add contact precautions. So you will need gloves, practicing good hand washing, a cover gown if you could get splatter, especially from vomitus, on your clothing. And because vomitus sprays, it's it's a good idea to use protective eyewear or a face shield if there's a potential risk of splashing. So why do we have to clean with a different product, a chlorine-based product for norovirus? It is what is known as a non-enveloped RNA virus, and alcohol does not kill it. So we need to use a chlorine-containing solution. We can mix bleach and water at 5 to 25 teaspoons per gallon of water, and we would mix that daily. Or we can use a bleach prepared solution. If one has exposure to norovirus, there is no treatment available or recommended other than rehydration of the infected individual. Well, there are many types of norovirus, as I said. What about the fact that there are 41 or even more different genotypes, with each having subtypes? Is there acquired immunity? Normally, when someone acquires an illness and recovers from it, they have acquired immunity. But it's a little bit different when it comes to norovirus. Immunity is very limited. For some of the genotypes, it's as short as 2 months to 2 years. So when we look at the fact that outbreaks occur in long-term care facilities, and we can understand that. We know that many of these surfaces in dining rooms and lounges are fabric and not really conducive to cleaning with bleach type solutions. So outbreaks are common, as we spoke about earlier, in long-term care facilities. Now, with regard to EMS, if we are transporting an individual diagnosed with norovirus, we need to know that. The facilities need to tell us if an individual is suspect for norovirus. That is so that we can use the proper cleaning solution post-transport and be sure that we have killed this virus and it is not still present in our vehicle where it could pose a threat to employees or to the next patient. So we need to meet with these facilities that we transport to and from and discuss setting up an interfacility transfer communication. This was first addressed in work done by the University of Arizona, and how important this is. You know, now that we are in the time of the fact that EMS now comes under the definition of healthcare associated infections, and Duke University coined a new term, medical transport associated infections, we need to make sure that we are properly cleaning our vehicles and equipment between patient transports. So we need to be made aware of information. In the meantime, making sure that we are cleaning with a product that is chlorine-based, maybe permanently. Remember C. diff, the new multi-drug resistant organism Candida auris, and Norovirus. All three require the use of a chlorine-based cleaning solution. That brings us to the very end of our brief introduction to norovirus, just to get the most important basics out to you up front. If you have additional questions, you would like additional information, please feel free to contact me. You have here my office number and my email address. Thank you for your time and attention, and I hope you will join me once again on another segment of Let's Get It Straight.